Today what I have been talking about the role of proton beam radiation in the treatment of breast cancer. Proton beam is very expensive, and in order for us to use it in breast cancer, it has to be very superior to the standard treatment, which is photons and electrons. So I was defining what is the best group of patients that will benefit from proton beam radiation. And I saw that women who have advanced breast cancer, who have been treated with mastectomy and received a lot of chemotherapy, because most of the chemotherapy used today are very much cardiotoxic, and they had the breast cancer on the left side, so if we treat them with the standard techniques, the heart will be exposed to radiation, and this can cause 10 to 15 years later a lot of cardiac problems, which will actually increase the cost of treatment. So if we can use proton beams, we can spare their hearts, and the cost of the proton, which is expensive, can be worthwhile if we really save this patient from some cardiac problem down the road. It can spare the structures around the tumor. When we use photons, photons should cross all the body. It doesn't stop. And if you have your target, which you want to treat, in the middle of the body, so all the structures before the target and after the targets get radiation. So if the heart is so close to the chest wall or to the left breast, when we treat the breast, part of the heart will get exposed to radiation. Now, proton has a completely different characteristic, that it can spare all the structures behind the target, so the proton just stops at the point where we want it to stop, and all the structures before the target will get exposed to almost half the radiation, which it would have received if we use the standard treatment. I certainly hope so. The reason why proton is very expensive, because there are only very few facilities around the world. I mean, the Japanese, they have a few. In Europe here, they started to build, and I know in Pavia, there is a very big facility which will be completed probably in a year or so. There is only, for instance, one facility in Italy. So that's why the cost is very high. But I think if the technology really progress, the cost of the treatment should go down. Maybe not in the near future. When you look at the history of radiation, we used to use cobalt machines, which were very cheap, but it had a lot of side effects, and all the cobalt machines were replaced by linear accelerators. So I think maybe in 10 to 20 years, the linear accelerators will be replaced by proton.